He is a Martin County native and former prosecutor whose path in life took a drastic turn more than a decade ago. Roped in the chains of alcoholism, a court bailiff and pastor helped lead him out of addiction and to find a relationship with Christ. He resigned from his position in the courtroom and began a quest to help those suffering from addiction find recovery. Today, his company operates more than 30 addiction treatment facilities across the Commonwealth. The founder and CEO of Addiction Recovery Care, Tim Robinson, is my guest tonight on Issues and Answers, the Mountain Edition.
From WYMT Mountain News, this is Issues and Answers, the Mountain Edition.
Attention Medicare beneficiaries. Are you getting all the benefits you need? If you have Medicare, you may now be able to get new benefits. Benefits may include eyeglasses, wellness visits, gym membership, meal delivery, and hearing aids with low copay. You may even find plans with zero monthly plan premiums, zero copays on many services, and zero deductible. To find out which benefits you qualify for and to find out if you're getting the benefits that you deserve, let Best Medcare do the work for you.
Tim Robinson, the CEO of Addiction Recovery Care, is my guest tonight on Issues and Answers. Tim, good to have you here with us.
Steve, thanks for having us. Thanks for having us on.
This is your first time on Issues and Answers. So first, I just want to give you a little chance to introduce yourself and tell me a little bit about your background.
So I'm originally from Martin County and now live in Lawrence County. So lifelong resident of Eastern Kentucky, and proud that after I got finished with school, I got to come home, and I love living here in the mountains. Unfortunately for me, when I was at the University of Kentucky College of Law, my mom died during second semester finals. And that started for me a battle with alcoholism that lasted 8 years, and I almost drank myself to death. And for me, I got sober when a court bailiff who was also a pastor led me to the Lord, and not only did I have a spiritual awakening and my faith become the source for all things in my life, but then there was also that same court bailiff who became my best friend, my pastor, my sponsor, and helped me walk through sobriety. And then shortly thereafter, a couple years later, just felt a calling because of my faith to start the organization that led to the opening of Karen's Place. And now we have seen demand for what we do unfortunately increase, and it's hard to be excited about that we've expanded, but we are blessed that we've got to meet some of the needs now, and we have over 30 treatment centers in 22 Kentucky counties.
So how long has it been now since ARC first started?
ARC started in November of 2008, and I got sober 15 years ago this past December.
And was it just alcohol? Was that your...
My struggle was alcoholism, and started drinking to deal with the stress of losing my mom, plus the stress of law school, and told myself that I could just drink until after finals and after she would pass. But with addiction, there's no innocent experimentation.
Right.
And for me, by the time that I was using alcohol to cope with the trauma of her loss, it had a hold on me. And the whole idea that we can quit on our own just isn't the reality with a disease like addiction. I'm
not sure people take alcoholism as seriously sometimes as drug abuse, but it can kill you, right?
Well, it can definitely crash your life. It can kill you. It doesn't sometimes get the same focus because, you know, when you're dealing with opioids, heroin, fentanyl, pain pills, you see overdoses. So it can kill you when your heart stops beating from an overdose. Alcohol sometimes is slower unless you're in an accident. It's a slower death, but the pain is still the same, the trauma is still the same, and it really interferes with people's lives.
About how many employees do you have now?
Today we're right around 1,100. And many of those 1,100 are here in Eastern Kentucky. And even though we've grown to some other areas of the state, our predominant network is here in Eastern Kentucky. And we felt from the beginning, we started here, we're from here, a responsibility to make sure there's services here in Eastern Kentucky.
Maybe your most well-known employee now is Noah Thompson, American Idol contestant. This is going to air after the finale, so we don't know if he's going to win. Hopefully he does. But what did he do for you guys?
So he's been with us since he graduated high school. So he started out doing lawn care with us, carrying a weed eater. And then just what you see on TV is what you get. He's a humble kid who wanted to learn, and so he went from lawn care and decided he wanted to learn how to be a contractor and be able to do carpentry. And so they trained him, and he made him into a good carpenter. And so right up until he left for the show this last time, he was actually working on our maintenance crew and hanging drywall and doing carpentry. And what you see on TV is what you get. He's just an authentic, great kid.
Did you know he could sing?
Oh yeah, yeah. Everybody around him knows he could sing. That's pretty clear, and you can also see that's his passion.
Yeah. Well, I think whether he wins or loses, I think he's got a career in country music, and you may lose him as an employee, I'm afraid. But talk about the homecoming in Louisa. Were you there?
Yeah, definitely was there, and our team got to be a big part of putting that event together. And many people said they've never seen a bigger crowd in Lawrence County. We estimate over 15,000 people at our football field for the concert. Of course, there was a parade, and it really uplifted our town. We've had some young people that have passed in the last few months, and so the town was down, and this has really went a long way in kind of bringing our community and lifting our spirits up. And so Noah's been able to do that for us, and we're awful proud of him. We're proud how well he's represented Eastern Kentucky to the world, and just so proud of him.
Do you think he's going to win?
I think he's going to win. I think we're talking about the next American Idol.
Well, we have a picture we want to put up of you with Noah and a baseball. Tell me the story behind that.
So at ARC, I'm a huge baseball fan. Everybody knows it. Go Dodgers! And every month when we do our monthly convocations, I give out Major League Baseballs as our Employee of the Month. It's getting a home run. And so when I knew I was going to get to see Noah when he come home for the homecoming, I had a baseball ready, and I asked him if he would sign a baseball for me, and he was so gracious to sign a baseball for me. And now I'll treasure that from now on.
He seems, like you said, just to be such a humble and great kid.
Yeah, he's the goodness that you see, the humility that you see is who he is, and I think his authenticity and being who he is and being this kid from Eastern Kentucky that cares about people, cares about his family, cares about everybody around him, cares about his little boy Walker. That's who he is. That's who he is 365 days of the year, and I think that's why America has fell in love with him, because what you see is what you get.
Well, hopefully by the time this airs, he'll be the next American Idol, and his life's getting ready to change forever, win or lose.
Those of us in Lawrence County have no doubt.
I think a lot of people are pulling for him. Let's talk a little bit more about Addiction Recovery Care, or ARC as many people call it. Are you surprised where you're at today from where you started? Are you surprised by the growth?
Yeah, there was no plan in the beginning. We were just trying to get a 16-bed grassroots ministry open back in 2008 when we started. We opened the first facility, Karen's Place, in 2010, and we couldn't see past that first facility. So this has all been a shock to us.
Yeah. A little over a month ago, you were in Atlanta for Operation Unite's Prescription Drug Abuse and Heroin Summit, which has been going on for a few years now. You got a pretty significant award from Congressman Rogers called the Beacon of Hope. Tell me what that moment was like for you.
So in addiction recovery, the biggest event every year is the RX Summit. And you'll have 4,000 professionals and champions for recovery from 50 states and 30 countries come to that summit. And it's become a place where 4 U.S. presidents have come. The Surgeon General's usually there, the head of HHS, CDC, NIH, NIDA, and so it is the gathering. And so when I got the call that they had selected me for Beacon of Hope, I'm not often speechless, but I was speechless. I didn't know what to say, and so humbled by that selection, and very special that this award carries Congressman Rogers, carries his name, because he has been the national champion on this issue.
You also, while there, you had an opportunity to sit at the table with the nation's director of drug control policy. Tell me about that discussion and how that went.
Well, it was good to be with someone that's spent a lot of their career here in Central Appalachia, and prior to becoming drug czar, Dr. Gupta was actually over public health in West Virginia. So he knows about rural public health issues like addiction, because it's hit West Virginia just like it has Kentucky. And one of the things that was pretty easy to see is he realizes that this is going to take a comprehensive approach. So a lot of our conversations were things like, how do we help people re-enter, and how do we address some of our workforce shortages by taking people in recovery who are on the sidelines today, many of them either unemployed or underemployed, and getting them back in the workforce and helping fill a lot of these jobs that are sitting empty today.
Yeah. Congressman Rogers, as you've mentioned, he's been a long supporter of your efforts and began Operation Unite back in April of 2003. How have you partnered with Unite through the years, and how has that relationship sort of evolved?
Yeah. So next year, as you mentioned, will be the 20th anniversary of Operation Unite. And that organization has plowed the ground not only for us to get started, but it's really been the organization that's plowed the ground for efforts across this country. And when you're at the RX Summit, it's pretty clear that people see Operation Unite as the national organization doing work in this. And part of that's because they've focused on a comprehensive approach. And so they've done a lot of efforts in law enforcement and trying to keep drugs off the street. But I think even more importantly is the work they've done being an advocate for treatment and recovery. And then I think that one of the big contributions is their prevention efforts and the thousands and thousands of kids that they've impacted, trying to make sure we get farther upstream and slow this thing down, because we're going to have to do that in order to recover.
You hear people say you can't arrest your way out of the drug problem. Do you agree with that?
I agree with that. I mean, we've got to hold people accountable that are a part of drug cartels, that are part of organized crime, that are dumping drugs like fentanyl and meth into our communities. But many people are people with a brain disease that have fallen into addiction, that need help and need a way out, and I've never seen anybody too far gone to recover.
Yeah. I understand in the years leading up to the pandemic, overdoses were surging in states surrounding Kentucky, but not in Kentucky. And unfortunately, that's changed some since the pandemic. Why, before the pandemic, were we going down and others were going up?
So I think there's a few things. We mentioned it earlier. Is Congressman Rogers has been called the Paul Revere of the opioid epidemic, because he did sound the alarm back in almost 20 years ago when he started Operation Unite. And so that efforts has built a comprehensive approach in Eastern Kentucky. And they paved the way for providers like us to get started, to be able to start offering addiction treatment. And then another significant milestone was in the summer of 2014, former Governor Steve Beshear added addiction treatment, residential treatment, to the Medicaid benefit in Kentucky. And that then became a fuel to add on to what was already happening here in Eastern Kentucky. And because of that, we've been able to expand access to treatment. And so when you look at Eastern Kentucky, the progress even surprised NORC, which is a policy part of the University of Chicago that looks at policy. And so one of the things they found in a 5-year period prior to COVID, that the region in America that had the most progress reducing overdoses is Eastern Kentucky. And I think that's because we've been here working for a long time, and we've looked at comprehensive things, that we not only need access to addiction treatment, which we have the best access in Kentucky, but we also need longer term recovery options. We need to be looking at re-entry. We need to be looking at vocational rehabilitation and job training. How do we cover gaps like transportation and childcare, and how do we really look at all these different social determinants of recovery and truly work on all of those things, and then go upstream and slow this down by reaching out to our kids and having true prevention efforts.
So what's changed since the pandemic?
So there's a few things that have changed. You know, mental health's been exacerbated because There was once a TED Talk that said that the opposite of addiction is connection, and that community is really the opposite of addiction, because addiction isolates you. So during the pandemic, we had AA meetings and NA meetings closed, Celebrate Recovery meetings closed. We had churches not getting to have services, and so all these social networks were suspended by and large during that. And then the other thing that happens is that our court systems and our law enforcement didn't get to be as active during that time, because we were trying to make sure that congregate living in jails were not spreading COVID. And so some people believe that we should decriminalize drugs, but one of the things we saw firsthand is if the court system isn't helping intervene in people in addiction's lives, a lot of them won't choose they won't choose to get treatment. So all those things have created sort of a public storm, perfect storm for addiction to worsen during that time. And then the other reality is fentanyl now. There was just an interception in Louisville of enough fentanyl to kill everybody in the state of Kentucky here in just recent times. And so fentanyl is the other big thing that's really making a big impact in these numbers, because it doesn't take very much fentanyl to kill somebody.
Yeah, and that seems to be one of the biggest problems right now that we're seeing is fentanyl, right?
Yeah, fentanyl is the thing that's driving a lot of our overdoses. And even though here in Eastern Kentucky for a long time, opioids was our number one substance of use, meth has had an uptick, and now probably about 40% of our clients have a primary meth abuse diagnosis. But that's being exacerbated also because now they're lacing meth with fentanyl. So you don't know what you're getting. And so if you're out there and somebody out there has got a family member, or if they themselves are experimenting or actually abusing drugs, now expect meth, marijuana, what you might think is actually a Percocet or a pain pill. Now most all of those things that have some level of fentanyl in it. And so there's a lot of people. There was even some West Point cadets overdosed thinking that they were getting cocaine, but it was actually fentanyl. And so fentanyl's now being put in everything out there, and so it's very, very dangerous.
What's your take on the marijuana debate? The medicinal marijuana, a lot of people are for legalizing recreational marijuana. What's your take on that?
So I'm against legalization of recreational marijuana. Every place that's done that has seen their drug problems getting worse. I think it is a gateway drug. I think now it's even more of a problem because they're lacing it with things like fentanyl. Would be really tough to regulate, and I don't think it's a direction we need to go. Medical marijuana, I think that as long as it's not something that we're heading toward as a step toward legalization of recreational marijuana, you know, evidence is pretty clear that some of the pharmaceutical grade THC can help some folks, but I think that's got to be a very, very conservative approach if we were to ever do anything.
You talked about workforce participation earlier. I know that's an issue you're passionate about. How can treatment married with training lead to greater long-term outcomes? So
when we look at workforce shortages that were here before COVID, been exacerbated by COVID, and we have a lot of employers, you know, even in rural parts of our state that are struggling finding workforce. My estimate, based on research that's been done in Central Appalachia, is we've got between 500,000 and 600,000 people in Kentucky that have a substance use disorder. Wow. So that's a lot of people out of 4 million plus.
Now, say that again. That's alarming.
Yeah, so 500,000 to 600,000 people. The state of Virginia studied their Medicaid population, and a third of their Medicaid population had a substance use disorder diagnosis in their medical background. In every indicator, Kentucky is worse than Virginia. So if we look at our Medicaid population today, which is about 1.5 million, and I'm not trying to pass judgment on that demographic, but if we look at that group, just that group alone, not that it's only in the poor that this is happening, because it's impacting every socioeconomic group that we have. But if you look at, we have about 1.5 million Medicaid members, and if a third of those if we use the proxy of Virginia, a third of those, we're looking 500,000 to 600,000 people with a substance use disorder in our state. So it's no wonder that we have a workforce problem, because most of those folks are either underemployed or unemployed, and we need them in the game. We don't need them on the sidelines. We don't need them underemployed. And so there's really not any road that's going to lead to workforce participation being higher if we don't help people, our neighbors, recover and get back in the game.
So how long is it going to take, do you fear, to get back to where we were before the pandemic? Is this something we're going to be dealing with for years, the repercussions of the pandemic?
Yeah, I think it's going to take some time. The good news is what we were doing before the pandemic, especially here in Eastern Kentucky, was working. Mm-hmm. And one of the things that I believe is back when we had an HIV epidemic in this country, and the country finally tuned in on the numbers of people we were losing, that was preventable in terms of prevention of HIV, treatment of HIV, and treatment of AIDS. We nationally made the kind of investment that it took to put that back on its knees. Mm-hmm. So I think that's one of the things that's going to have to happen nationally. And, you know, Congressman Rogers has been one of those voices for a long time that's been trying to get the federal government to make those kind of investments. And so we're going to have to do that, because the reality is there is no silver bullet. Everybody's been trying to find a silver bullet. The reality is addiction is chronic, it's long-term, it's a brain disease. There's no quick, easy fix. The only thing that we've seen that works is we value every person as our neighbor. We give them the treatment they need. We get them detoxed. We give them excellent treatment. We help them with recovery support. For many of them now, haven't had a vocational opportunity, so we got to give them vocational training, and then we've got to get them in job training and get them where they can make a living. That, if we make that investment over the course of a year in somebody's life, we see great returns on those investments in terms of getting people back well.
What is your success rate? So
for everybody that comes in our doors that does that full program,
mm-hmm.
that'll go through detox, residential, vocational rehabilitation, transition, job training, it's over 80% success. And that's not a marketing number, that's what we've observed. And one of the places that we really see that is today, out of that 1,100 employees, about 600 of that 1,100 are in recovery, and probably almost half of our workforce started out as clients walking through our doors. Wow. So we're proof positive that a second chance workforce mm-hmm. can allow an organization to be strong, that people in recovery are talented, they're hardworking, they're grateful, they make great employees. They just need an opportunity.
Are your facilities staying full?
Unfortunately, our facilities are full, but if we truly had addiction treatment fully integrated into society and the interventions happening, we couldn't build enough beds right now. And so, you know, we've got about 12 to 1,300 beds today. So if you think about 12 to 1,300 beds with 500,000 people addicted, we only have, and we're the largest provider of that in Kentucky, we don't have enough beds. And so some of the work that we have is we do need more resources, we need more beds, but we have to have addiction treated as a subspecialty. So if you go into a hospital or doctor, they know how to get you into treatment just like they would if you had a heart condition or some other specialty need. We don't have that today. Our court systems are doing a better and better job of making interventions. There was actually a pilot program that was passed with bipartisan support in the legislature this last time, Senate Bill 90, that's going to create 10 pilots across the state to intervene in people's lives and get them into treatment and encourage them to get job training. And so those are the kinds of things that we're going to have to keep doing.
You hear concerns in many communities about the opening of treatment facilities and how that will impact the town. It could lead to more homeless people. Are those legitimate concerns?
Well, and I get where that, you know, addiction is such a sort of a mysterious thing, and people in communities are frustrated because where there's high rates of addiction, there's also high rates of petty theft and all those kinds of things. And so I get all that. Mm-hmm. But the reality is addiction treatment doesn't cause homelessness. Like in our county, in Lawrence County, we do have more homeless we have more homeless people than we did a few years ago. But every community is experiencing that. It's at crisis level in places like Louisville. We work with some of the folks in Louisville, and we actually have outreach programs to the homeless. And so it's impacting everywhere, even rural areas where we're not used to it. So the connection between having addiction treatment services and increases in the homeless, there's probably an actual opposite effect. And so if you look like Letcher County is a model for what a community should do to respond to its addiction problem. About 3 or 4 years ago, we partnered with ARH Health System, Mountain Comprehensive Health Corporation, a large FQHC that's here in Eastern Kentucky, the district judge there, Kevin Mullins, and several other groups, the health department. We started to heal Letcher County, and in 3 years, we reduced the number of opioid prescriptions per person by 70% in Letcher County. And now we've had to start a transitional housing program there. We're training carpenters there. You can go into any doctor's office at MCHC and they can help you access either a medically assisted treatment program or get you a fast-track admission into one of our ARC facilities or another residential provider. And so that sort of recovery ecosystem is being built there. And so you're seeing when a community comes together and makes addiction a subspecialty, makes it an important part of the court system. You know, Judge Kevin Mullins, per capita there, the district judge, has ordered more people to treatment probably than any judge in the United States. And it's making a big impact there to change things.
There's a study, I understand, from the CDC that found overdose rates among our vulnerable youth during the next 2 years are expected to double. That's really concerning, isn't it?
We're seeing it everywhere, and one of the statistics that's really upsetting, if you really think about it, is now in Eastern Kentucky, in Appalachia, the census data shows that well over half, approaching 60% of elementary school age kids in any elementary school you want to go to in Eastern Kentucky, the kids are being raised by neither biological parent. And so what that does is set the stage for the 2 biggest risk factors in addiction, which is abandonment, a sense of abandonment, and a sense of rejection. And so that becomes a hotbed for addiction. And so you take that and you exasperate all those problems that are happening at home right now, and the amount of adverse childhood experiences happening to our kids from a young age. Now we're seeing 3rd and 4th generation addiction, a cycle that's occurring. And so it's no wonder that overdoses, suicides, and all those things, these mental health issues are on the rise. And you know, we're just now starting to get access to treatment for the adult population. When it comes to our kids, the adolescents, the middle school, high school kids, we might have 10% of the resources we need.
We only have about a minute and a half left. I want to put up the ARC website, and also you have a hotline, a 24-hour hotline people can call. If somebody, while we put these up, if somebody is watching right now, they have an addiction or knows a family member or friend that's suffering, what would you tell them? So,
nobody's too far gone, and even though sometimes addiction seems hopeless, there is a lot of hope, and there are people that God has called to wrap His care and His love and His resources around people. So find treatment, find it, whether or not somebody's willing to go, help them find that, call us, call another provider, get somebody into treatment. Casey's Law works. So Casey's Law is something that's pretty unique to Kentucky, where you can court order somebody with a drug issue, you can court order them to treatment. It's not true that somebody has to want help to get help. I have, out of 600 employees, I don't know how many dozens and dozens of them found help through Casey's Law. It's a great option. Those are things we can help with, other providers can help with. And I know sometimes this thing seems hopeless, but we've got some things that we're figuring out in Eastern Kentucky, and we may be ground zero of the national opioid epidemic, but because of efforts like Congressman Rogers has led with Operation Unite, providers like ARC who've expanded access to treatment, Eastern Kentucky is a place that is recovering and is going to recover, and there's a lot of resources here.
Tim, appreciate you.
Thank you.
Thank you for joining us. We'll see you next time on Issues and Answers.